Test the sense of smell by presenting the patient with familiar non-irritating odors. First, make sure that each nasal passage is patent by compressing one side of the nose and asking the patient to sniff through the other. Then ask the patient to close both the eye. Oculate one nostril and test smell in the other with substance like clove, coffee, or vanilla. Ask the patient to identify each odor. Test smell on the other side. Normally, the patient perceives odor on each side and identify them correctly. Position the patient 20 feet from the chart. Now we are going to test your vision. If you can just look over to this chart, I want you to start by testing your vision. Just read the smallest letters possible for you. L E T D O F P E T O Z C D L P O E T D F C T F L Z. Okay, thank you. Now you are going to cover your other eye. O F C D O T E C T D E P L Z T E C O T P F O P D L O C Z T. Okay, thank you. Test the visual fields by confrontation. Test each eye separately and both eyes together. Wiggle your fingers and slowly bring your moving fingers forward into the patient's center of view. Ask the patient to tell you as soon as he or she sees your finger movement. Inspect the size and shape of the pupil and compare one side with the other. Test the pupillary reactions to light. Test the extraocular movement in the six cardinal direction of gaze and look for loss of conjugate movement in any of six direction which causes diplopia. Ask patient which direction make the diplopia worse. Identify any nystagmus. Note the direction of gaze in which it appears, the plane of the nystagmus and the direction of the quick and slow movement. Look for ptosis, dropping of upper eyelid. Use a suitable sharp object such as pin or cotton swab. To avoid transmitting infection, use a new object for each patient. While testing, occasionally substitute the blunt end for the point as contrasting stimulus. Ask patient to report whether each stimulus is sharp or dull and to compare sides. Ask a patient to look up and away from you and approach from the opposite side of the patient line of vision. Avoiding the eyelashes, lightly touch the cornea with a fine wisp of cotton. Inspect the face both at rest and during conversation with the patient. Note any asymmetry often visible in the nasolabial folds. Ask patient to raise both eyebrows. Close both eyes tightly so that you cannot open them. Test muscular strength by trying to open them. Show both upper and lower teeth. Smile. And then puff out your both the cheeks. Assess hearing with the whispered voice test. Ask patient to repeat numbers whispered into one ear while blocking or rubbing your fingers next to the contralateral ear. Ask the patient to say ah or to yawn as you watch the movement of soft palate and the pharynx. The soft palate normally rises symmetrically. The vulva remains in the midline. Each side of the posterior moves medially like a curtain. Stand behind the patient, look for atrophy or fasciculation in the trapezius muscle, and compare one side with the other. Ask patient to shrug both shoulders upward against your hands. Ask patient to turn his or her head to each side against your hand. Observe the contraction of the opposite sternocleidomastoid muscle and note the force of movement against your hand. Inspect the patient tongue as it lies on the floor of the mouth. Look for any atrophy or fasciculation. Some coarser, restless movements are normal. Then, with the patient tongue protruded, look for asymmetry, atrophy, or deviation from the midline.